Hello, I'm Ann Kloos, and we all want to thank the EHDN for inviting us to do this presentation. We're very excited to tell you about the accomplishments of our physiotherapy working group. In 2016, a guideline development group was formed with support from the EHDN, the Huntington Study Group, and the Griffin Foundation. And the goal was to develop a clinical practice guideline for physical therapy and exercise interventions in Huntington's. We first conducted a mixed method systematic review using Joanna Briggs Institute methodology that included both experimental and observational study designs. And from that systematic review, then, we developed the clinical practice guidelines, which were published in the Neurology Journal in 2020. And what we found is that there actually is strong evidence now that aerobic training, with or without resistance training, can improve fitness and motor function in people with Huntington's. We also found strong evidence for supervised gait training to improve spatiotemporal features of gait. There is also weaker evidence that exercise does improve balance, but it did not affect fall frequency. There's also evidence that respiratory training can improve breathing function and capacity. And in later stages of the disease, we know that transfer training or training to get up from the floor and other compensatory interventions may be beneficial. And also in terms of getting people with Huntington's, as we know they have lots of apathy, and getting them to be able to adhere to exercise, one of the biggest facilitators is to have a caregiver who will coach the person and help them to maintain exercise throughout and activity throughout the disease. So what the physiotherapy working group, of course, wants to promote and see implementation of these clinical practice guidelines into clinical practice. So we've been working, and we did develop summaries of these guidelines that are for the use of physiotherapists and for the public. And they're accessible now on our EHDN Physiotherapy Working Group website. And individual members of our group have actually translated these summaries from English into all of the languages that you see listed there. I'll now turn it over to Una.
Thank you, Anne. I'm Una Jones. So I think that we've fairly much aligned with the aims of the EHDN in that we have developed guidelines, and our next stage then is to try and implement those guidelines in practice. So we carried out a global survey looking at the facilitators and barriers to implementing physiotherapy guidelines, and this has recently been published in the Journal of Huntington's Disease. It is a small number of people of respondents, and so we have that as a limitation. But if we look at the facilitators, they were predominantly around physiotherapy professional practice, like support from colleagues and the expertise in developing individualized plans. Whereas the barriers were much more about HD-specific attributes, the physical, the behavioural and low motivation. So armed with this information, following on from our aims of having an internationally consistent approach, what we've done is develop 3 work streams. So the work stream, we've got residential setting, Huntington's disease specialist clinics and the community setting. And within these groups, what we're trying to do then is develop ways in which we can help support physiotherapists implement the guidelines in practice.
There we go.
I'm going to tell you about our work streams and the work we've been doing up until now. The community work stream has been looking towards ways to disseminate the information and how do we get information in from all interested parties, so caregivers, individuals with Huntington's disease, and healthcare providers, and even industry members. They've been working towards that goal. The residential care stream looked at how can we disseminate information to care providers in residential care settings, and they developed and delivered a pilot interactive online educational session in the UK. That was hosted by the Huntington's Disease Association of England and Wales, and they're also looking at ways to develop other fact sheets and things like that, and have started that work. Our HD Specialist Clinics work stream has developed fact sheets for patients and providers that are focused on the care of pre-manifest and early disease individuals, and the topics were based on what we found in the guidelines. So they've been looking at barriers for preventing participation in exercise, gait and balance training, and aerobic and strength training. And then our ongoing work, what we discussed at our meeting yesterday, so where to move forward. We all have posters, so we welcome everyone to come to those posters. They're in the age 23 to about 29 range. So there's 4 that are specific to the work streams, and then several other posters from work that has been published from these groups. But the community work stream is looking to do co-design with all of you and patients, caregivers, whoever, to find out what's the best way for us to get this information out. So please go to their poster, grab a stick-it note, and put your opinion down and stick it up there. The residential care group, we would really like to see how to disseminate what was done in the UK out across Europe. And the HD specialist clinics are moving on to focus on mid to late stage disease and information for providers that work in specialist clinics. And we're ready for questions.
Ralph, do you need a microphone?
Thank you. Well, first of all, Anne, Una, and Deb, congratulations for excellent work. I think your working group is doing a fantastic job, and it's been fun to follow you for many years. Now that you created so much evidence, my question is, obviously this evidence has been published and has been there for quite a while, which is great, and it's growing. Have you ever looked at the assessments that I think we do in Enroll HD and we have done in registry and possibly in cohort? Has there been a change in uptake of physiotherapy now that the evidence is presented and published by neurologists and by the community? Has there been an impact? Have you ever assessed that, or is that within your merits of things you might want to do in the future?
I think thank you very much for that question. That is our core aim now, is to look at the impact. And when we met yesterday, we were talking about how we actually implement this in real practice. How do we get to physiotherapists? And we aim to get to physiotherapists through physiotherapy groups, through the EHDN, through Enroll, but also through patients. We want to work with the EHA and the HDSA. In terms of impact, we're developing our monitoring and evaluation plans so that we can see how we've got impact there. That's really tricky because I'm not sure yet. I don't know that within Enroll there's a question, have you seen a physiotherapist? It's really a challenge to us, but it's one that we're ready to take on.
I have another question.
Yeah.
You've been mentioning your educational efforts to improve education using webinars and such tools. How can we learn about these tools? When will you have your next webinar?
When will we have the next webinar?
I'm asking because we, as medics, we work with lots of different physiotherapists who happen to have one patient or two sometimes.
Exactly.
and they're very keen to learn more about assessments, the guidelines, how to implement them, and so on. So it would be wonderful, a wonderful resource if we could point them in that direction.
Yes, that would be really wonderful. I know that within the UK that we help through the Huntington's Disease Association and do professional training courses there. So what we need to do is maybe use that as a template across and try and, you know, and as you say, and link with Anne Rosser and with the think tank of how we can, you know, disseminate and publicise our work across the community.
Mm-hmm.
Thank you.
There's one more question down there, please.
Hiya. Thank you so much for the wonderful talk. Right here. Hi. I haven't had the pleasure of reading the publication yet, but I was hoping to ask a question. If, when you were examining the type of exercise, were you looking at different types, and was one more effective at kind of helping aid in, you know, improving balance? I know that you talked about that there wasn't a kind of positive effect for fall frequency, but was there a type of exercise that was more beneficial to the patients over others?
I'll take this, but you can correct me if I'm wrong, that there were a number of different types of exercise studies. So there were at home, in community centres. What other sorts of studies were carried out? But there were no comparisons across the different types of exercise. We don't have that big, broad range of studies yet. Just the general consensus that exercise did improve aerobic fitness. Thank you very much.
Thanks.